Hi, welcome back to our channel. We're glad to have you join us once again. Today, we're going to be talking about an important topic: understanding the different types of diabetes. Diabetes is a chronic medical condition that occurs when the body cannot produce enough insulin or when it cannot effectively use the insulin it produces. It is a serious disease, but with proper care, treatment, and early detection, you can manage it effectively. Section 1. What is diabetes? Before we dive into the types of diabetes, let's understand what diabetes is. Diabetes is a disease that affects how your body uses glucose, which is the main source of energy for our cells. Insulin, produced by the pancreas, is responsible for transporting glucose from the bloodstream to the cells of our body. When we eat food, the insulin released gets the signal to break it down and convert the glucose from the food into energy that our body requires. However, when the pancreas does not produce enough insulin, or when our body cannot use it effectively, glucose builds up in our blood, leading to high blood sugar levels and diabetes. Section 2. Understanding types of diabetes. There are three main types of diabetes. They are type 1, type 2, and gestational diabetes. Let's delve into what each type of diabetes entails. Type 1 diabetes. Type 1 diabetes is an autoimmune disease that occurs when the immune system attacks and destroys the cells in the pancreas that make insulin. This results in an insufficient amount of insulin production in the body. Type 1 diabetes is prevalent in children and young adults. Symptoms of type 1 diabetes include increased thirst, fatigue, frequent urination, and unexplained weight loss. Type 1 diabetes cannot be cured, but it can be managed with insulin injections, medication, and a healthy lifestyle. Type 2 diabetes. Type 2 diabetes is the most common type of diabetes and occurs when the body becomes resistant to insulin, or when the pancreas doesn't produce enough insulin to move glucose into the cells effectively. Type 2 diabetes mainly affects adults, but it can also affect children. Risk factors for type 2 diabetes include obesity, lack of physical activity, high blood pressure, and high cholesterol levels. Signs and symptoms of type 2 diabetes include increased thirst, frequent urination, blurred vision, fatigue, and slow healing of wounds. Type 2 diabetes can be managed by adopting a healthy lifestyle, changing one's diet, and by taking medication. Gestational diabetes. Gestational diabetes is a specific type of diabetes that occurs in pregnant women who did not have diabetes before becoming pregnant. It affects approximately 1 in 10 women during pregnancy and usually develops during the second or third trimester. The hormones produced by the placenta can make it harder for insulin to do its job, leading to high blood sugar levels. Symptoms of gestational diabetes include increased thirst, blurred vision, and frequent urination. It is often diagnosed through a glucose screening test between weeks 24 and 28 of pregnancy. Most women with gestational diabetes can manage their blood sugar levels by making healthy lifestyle choices, monitoring their glucose levels regularly, and following a proper diet plan. Section 3. Other types of diabetes. Aside from the three main types of diabetes discussed, other types of diabetes can occur. LADA diabetes. LADA stands for latent autoimmune diabetes in adults. It is a slow-moving variation of type 1 diabetes. LADA is a progressive disease in which the body's immune system slowly destroys pancreatic cells. LADA diabetes is often misdiagnosed as type 2 diabetes because it usually affects adults over 30 years old and has a slower progression of symptoms. The primary differences lie in its autoimmune origin and the need for insulin therapy. MODY diabetes. MODY stands for maturity onset diabetes of the young. It is a rare, inheritable form of diabetes that usually develops before the age of 25. MODY diabetes occurs due to mutations in certain genes that regulate insulin production and secretion. As with other types of diabetes, symptoms may include increased thirst, blurred vision, fatigue, and frequent urination. Treatment typically involves lifestyle changes and medications to help control blood sugar levels. Conclusion. In conclusion, understanding the different types of diabetes is essential in managing the disease and getting the right treatment. Early detection, regular monitoring of blood sugar levels, and an appropriate lifestyle play a crucial role in managing diabetes. If you think you may have diabetes, it's important to consult with a doctor as soon as possible. Thank you for watching, and stay tuned for more informative videos. Don't forget to like, comment, and subscribe to our channel for more health-related content. Bye for now.